experts have shifted that guidance. We were talking about this a few minutes ago. This is a big story today. Joining us right now with more about this is Dr. Stephanie Saucier, a cardiologist with Hartford HealthCare. Doctor, thank you very much for being here today. We appreciate your time.
Thank you so much for having me this evening.
So this can obviously impact a lot of people. Talk a little, if you could, about what the new recommendation is. What are they saying here?
Absolutely. So the U.S. Preventative Task Force is basically catching up with the research that we've had over the past few years. The guidelines in 2019 came out saying that not everyone should be on an aspirin to prevent a first heart attack or stroke. Now, that's very different from patients who are already on a low-dose aspirin following a heart attack or following a stroke. This is really to prevent a first heart attack or stroke. We found that patients at an older age, over the age of 60, had increased bleeding risk. So not necessarily everyone really should be on a statin. If you are on, an aspirin, if you are on an aspirin because of a prior heart attack or stroke, then that's something you need to stay on. But just to be on an aspirin because you're over the age of 50 is no longer recommended. People who are also at high risk of having heart disease or strokes should consider being on an aspirin. And that's really a conversation with your cardiologist or your primary care doctor.
It's interesting because you've probably heard from people over the years who say, oh, I heard about this. I just started taking a Tylenol myself. That's aspirin, I should say. But that's something you don't want people to do, right?
Correct. We don't want people just to start taking aspirin just because they hit a magic number or age. We really want you to evaluate your risk with your primary care physician or your cardiologist and take an aspirin if it's recommended for you by your healthcare provider.
And if you're on it now because your doctor put you on it, don't stop, correct?
Correct. Don't stop taking an aspirin because chances are we're using it to protect you from something else. You are high risk, or we're protecting you from a future heart attack or a future stroke. So don't stop it if you're on it. But also, if you hit the age of 50 or 60, don't start taking an aspirin just because. Talk with your doctor.
Now, before we let you go, doctor, any new recommendations for the population, this particular population, when it comes to prevention?
So the population, we recommend continuing to eat healthy, exercise, monitor and manage your blood pressure, diabetes, sugars, cholesterol. All of these things are really key to primary prevention. And of course, not smoking. That's one of the biggest risk factors for heart disease. So keep being active and doing all of those healthy things for you, and talk with your doctor. Maybe you are at risk, but maybe you're not. So don't just start taking an aspirin.
All right, good advice, Dr. Stephanie Saucier. Thank you so much for joining us this afternoon. We appreciate your time.
Thank you for having me.